Bob and Brad, the two most famous physical therapists on the internet.
Check.
Hi, folks. I'm Bob Shop, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Well, what should we talk about today, Brad? How about how to fix plantar fasciitis while you walk? Seriously?
Well, Bob, as we know, plantar fasciitis, foot pain, typically on the heel, but it can last for weeks, months,
Right.
and actually up to a couple
Even
years.
years, yes.
It's a real debilitating type of a problem.
Right. I'm going to mention, Brad, by the way, we're always doing a giveaway. You can check it out at bobandbrad.com. Go to the giveaway section, and we are giving away...
Oh, what?
You're not even ready for this. Booyah Stik.
I'm feeling strong today, Bob.
This
Anyways,
has nothing to do with plantar fasciitis, but you'll find other reasons to
and you
have
don't
it.
really hit with them. We use them for exercises, balance, and some real good therapeutic things.
So do you want me to show where plantar fasciitis occurs?
Yeah, let's talk about some of the symptoms and, what people, if they're experiencing this, and I bet you anything, people are going to say, it hurts when I get out of bed in the morning and I
Right.
put that initial weight on it, and it kind of makes you walk like this for a while, but it gets better with a little
It's
time.
very typical, yeah. Actually, what we're dealing with is some type fibrous material that runs on the bottom of the foot all the way up into the toes.
Sure.
And during the night, it begins to start to heal.
Yes.
And then in the morning, when you step on it, you break open the healing.
Yeah, it's actually like this, and then, because your foot, I don't show plantar flex, you sleep kind of like this.
Right.
And so things
it
tighten
tightens
up, and then you step on it, and
and you-
it pulls apart. And so it's like pulling the scab off of a wound.
Right. Very common right in this spot, right here.
Yeah.
That's the telltale sign.
Yeah, when I
That's
have a
right there.
patient, I'll kind of push around that area and see,
Right.
look at their face and see if it hurts. But usually when you get right in there, their eyes open up and it's like, ow.
Yep. So, do we want to start with how we're gonna treat it, Brad?
Well, yes. So,
Okay.
yeah, people are probably interested in seeing how that's what the title talks
So
about.
one thing in the morning, the first thing you should do before you get out of bed,
Right.
all of these things you should do before you get out of bed.
Right.
Yeah,
This is really critical.
But the first one is you're going to stretch the plantar fascia. So I'm actually going to take my hand, I'm going to grab the top of my foot here, the forefoot, and I'm going to pull back the toes and the foot this direction and give it a good stretch.
Yeah. So you can do it while you're lying on your back in bed. You can sit on the edge of the bed while you do this, but do not get up and walk around yet.
I'm impressed. You said lying right.
Well, yeah,
You didn't say laying in bed.
Well, yeah, because I watched another video and they said it too, so I knew
Sure.
the English majors were correct.
Yep. And then you want to do a little bit of massage
Yes.
to the area. Now, you can do it with your fingers or your thumbs.
Yeah.
Now, a good way to start is actually not hit the painful area to start, maybe work around it.
Sure.
Start hitting the spots, circumference around the area. And
Oh,
you can
yes.
actually do splaying massage where you put your thumbs together and pull them apart like this.
Yeah.
And eventually get onto the spot.
Yep. And you can see, you're pushing in deep.
Yes,
The
this
plantar
is-
fascia is really tough material. You got to get in there and work it. Your thumbs will get tired if you're doing it properly.
Right. Now, if you want to splurge, go ahead and use a massage gun. And we got one here that actually has the ball on attachment.
Yep.
And Brad came up with this because you think about when you start one of these that you would go right on here like that. And you can, but it's a lot more effective if you actually come in from the side
Right.
and work it this way. And again, I would work around the painful area. And then if you can tolerate it, hit the painful area.
Now, you don't have to do the gun massage.
No.
If you don't have one, simply do it manually, and then we'll go to the next step, which we'll get to in a second. But this really does feel good.
Well, it's easy to do.
It is.
Yeah.
You don't wear your thumbs out, especially if you have arthritis in your fingers or your thumbs, if you're like Bob's and our age where that kind of starts to happen. This really is a nice hand saver and finger saver. So actually, you'll get out of bed, you do the stretch, that'll take 30 seconds. You'll do this, that'll take a minute or two. So you got
Right.
maybe 2 minutes total of preparation.
Right.
And then what we're going to do is, like the title says, heal it while you walk.
Right.
So what we're going to go to is kinesio tape.
Right. K-tape.
K-tape.
Right.
And this is a product that a process that Bob and I years ago were kind of poo-pooing. It's like, well,
Right.
does it really work or not? And we've done more investigation into it. And then we got a hold of this John Gibbons.
Yeah, he was on our podcast, and he convinced me that to take another look at it.
Right,
And
right.
he does a lot of it.
And he'd been doing it for over 20 years.
Yeah,
He
he's
is an
been-
expert.
And he gets involved in whole other areas too, not just K-tape.
Right.
So
So we're going to use his recommendation on how to K-tape
Sure.
for this. And I'm going to show you now what I did is actually yesterday. I thought, I want to see how this really works on my feet. So I taped myself yesterday, and I wore my shoes and whatnot all day yesterday and all night. And I got up this morning, and I went to the pool. I
And
went
you
swimming.
went swimming.
I went swimming with it. And I thought it held up very good. You can see it's holding on.
curling
good
a little
here.
bit on the bottom.
It
now.
is right down here. It did come off before I went swimming. That was tight as could be. So
Sure.
I'm walking across the pool, wet and whatnot, swimming. So
But it's still hitting the area where you want it to hit.
right, exactly. So I'm going to pull this off, and I'll demonstrate how you apply this properly, according to John. This is a nice book. We do have
Yeah.
this if you want it. He goes over all the parts of the body.
A practical guide to kinesiology tape
Yep.
for injury prevention and common medical
Yep.
conditions.
Yep. I've been using this on my wife's shoulder. She's been happy with it.
And trigger figure too.
Oh, that's right. We just
Yeah.
did it with that. I really don't think it's something that's going to cure everything just
No,
like that, but I
no.
think it assists,
It helps.
accelerates the healing process.
Right.
So,
Protects the joint and the area.
yep, exactly. That tissue that we're supporting. So you get done with your massage, the stretching of the big toe, like we talked about. Do your massage.
Do
So
your massage.
about 2 minutes into it. Then you do have to have clean skin. That is a really key for this. There is one precaution I do need to mention. There is adhesive on this. It's made so that there's a least chance of having a reaction to it, but it's possible that you have a reaction to the adhesive tape. If you don't have a problem with Band-Aids or any other things, you're probably fine.
What I've found, Brad, is it usually doesn't bother the first time, but maybe after you've done it for a couple of weeks,
Mm-hmm.
then it becomes irritated.
One way or another, if your skin gets irritated,
Yeah,
you
you
can't
gotta
use
stop.
it. But the vast majority of people do not have any problem with it.
Right.
So there's a little trick to using this. When I cut it off, I had a roll of tape like here. He recommends this rock tape.
Yeah.
We don't have any affiliation with it at all, but he says it's good. Actually, this is not rock tape, and what I had on, and it worked fine. But you take it off the spool, and then you're going to cut.
You round the edges.
Yep, rounded edges,
Sure.
just a regular pair of scissors or whatever you have. So that's what I did. I'm using 2 different colors. There's no reason it's the
Sure.
same tape. And the way I did it, I just went like this, and it worked pretty well. So sitting on the edge of the bed, what you do is it's really nice. You don't have to sit there and kind of
Yeah.
peel it off. You
Yeah,
just
you rip it.
you rip it and you pull, and it's a stretchy tape. It works really nice. Get rid of that. Now, at home, you may want to put it in the garbage, depending on, like my wife would not be
Oh, my
happy if
gosh.
these were laying all
My
over.
wife would be.
So
all
here
over
we
that.
go. We put the first one right here, just at the base of the toe. No stretch at this point. Okay, I'm going to hold there, and I'm going to pull. There we go. And that takes
Oh, you're pretty good at that, Brad.
Yeah, it's kind of fun. I've been practicing. Yeah, once you do it a few times, it gets real easy. Now, you can stretch this to 100%. You'll feel it stop. And then we're going to go back down about half. So we're at 50% stretch. And, have some alcohol wipe or a bottle of isopropyl alcohol. Get all the oils and whatnot off your
prior
skin.
to putting the tape
Get
on.
it clean. That's critical. And it feels good on your foot. Nice, cool as it evaporates.
Sure.
And you go like this, and you rub it on. And then as you get around the heel, the calcaneus, as you're keeping that 50% stretch, and then when you get to the last inch, no stretch. So no stretch here, no stretch here, and that helps the tape stay
on,
anchored.
yes.
Exactly.
Right.
And then you take the tape cover or the adhesive covering. You're going to go to the one
You gotta
side.
warm it up.
Yeah, one side is a little sticky, and the other side slips better. You go on the slippier side, and you do this for 20, 30 seconds, and that helps seal the adhesive to your skin so it stays. Then you take the other one, okay?
That's going to be like a stirrup.
Yeah. Now
Yeah.
I think this is the key.
This is the one,
This
right?
is the key.
It really helps.
Yeah. Now, when you do this, you want to have your foot dorsiflex. I want to mention that when you do this, don't have it down here.
You
Dorsiflex
bring it up that way.
before you put that on. I
Right.
apologize. I'm a little out of order there. Okay. Now, so I'm going to pull that off and do the second one. Now, make sure you get this right. So you might want to look. You're going to start on the medial side. In other words, this ankle as opposed to
On
this
the inside.
ankle. Yep.
Yeah.
And we're going to go here. Again, no stretch to start with. Now on this one, I'm going to get that off. You go all the way 100% and then back off just a little bit so you get 75% stretch. A little bit stronger. Go right over like where Bob has that red spot on his ankle.
Yeah.
You're going over the sore spot. You come around. And when you get to the ankle bone on the other side, then you back off to 50%. And at the very end, here, maybe we can get it here. Can you still get that?
And again, no stretch at the end.
Right. So right here, there's no stretch. We anchor that down. And again, you're going to take a few seconds to seal that baby in
So
there.
how many days does it last, really? We don't know maybe yet.
It's going to vary from person to person
And
because
how active they are and how
how
much
much
they
your,
sweat,
your
how
feet
much they
perspire if you
you
go
swim,
swimming every day.
right.
But really, it's one of those things. I think typically I've used this on other parts of my body, and I've got 2 to 3 days on it. On my hamstrings, I just used it this summer.
I would put it over your mouth.
Well, yeah, that's been mentioned at home. And,
Yeah, that would serve the best purpose of all.
exactly.
But
So,
you look like an Olympic athlete now.
yeah,
with the
you
tape
know,
on.
yeah, I felt pretty cool walking at the pool. I got tape on my foot. What do you say? So, anyways, you'll leave it on as long as you can now, because you can massage over this the next morning.
Right, right.
By hand
And put shoes on
before you
get up.
Thank you, Bob.
You should wear your shoes all day long when you're dealing with plantar fasciitis
Yep.
because we're trying to get it to heal. Once it heals, then you can stop wearing shoes again or whenever you walk around the house. Well,
Exactly. So there you go. I
There you
think
go.
we've got, once again, Bob, we've covered another part of the body, but
we can fix about anything
except for,
a broken heart.
but we continue to work on that, and I really think that we can use kind of this for some kind of a
Oh my God.
adjunct to
Oh
it.
my God.
Yeah, be careful in everything that you do. Thank you.
Thanks.